Okay, so let's get started. So I'm Martin Reidevall, I'm the CEO of Skyresponse, and today we will talk about moving from analog to smart care. Skyresponse has been a supplier of care alarms for multiple years, and we are active within Nordics, UK, and also a few European countries. But moving from analog to smart care is something that is of importance for us and for the elderly, as you can see from this webinar that you will get a lot of benefits once you go into the smart care area. So we will make this webinar and the presentation. I will start the sharing. So just before we start, I want to show a little bit about the setup. First of all, we will have questions and you can use the chat function. And Anna will monitor that and we will open up for questions at the end. We will do a quick survey during the webinars so you can interact with during the presentation. On the use case, we will also use this visualization of the effort and the results related to the things we're presenting. And on the left side, presenting the efforts, whether it's increased or decreased or neutral. And then to the right of that, you see the results. Embedded in all the use cases are also QR codes to either an article or to the supplier's web information. So you can use that to find out more about the things we're talking about. In the agenda, we will talk about from analog to digital to smart. We will talk about market trends in general and numbers on European level. We will talk about how to move from analog to smart care and what the benefits are, and then go through several real-world examples about this smart care and what the effects of implementing smart cares. Then we'll go through a quick summary and we will open up for Q&A at the end. Analog to digital to smart, it happens everywhere. And this is just two very simple examples. Watches going from analog watches to digital and then to smart watches. And you have the same in multiple other areas. And the other example here is temperature thermometers, which is going the same direction. So it's happening everywhere around us. And of course, that's something that's going to happen into elderly care. What's important to understand is that some markets goes directly from or jump over the analog side and even the digital side and go directly smart. And this is a great example, I think. The sub-Sahara Africa has a penetration of landlines of only 2%, but the penetration of smartphones with internet access is actually 30–35%. And only in a few years, people believe it's going to be up to 60%. People are basically jumping directly into smartphones, and that's where they get access to internet. That's where they use the services that we have in Europe. An example of that is actually mobile money. That's been a service that's been available for some 20 years in Africa. So people are not always going through the same steps. Sometimes they do a frog leap, go directly to smart. And that's also an opportunity now within care, and we will talk more on how to do that. If you're looking at the European elderly care market, it's overall divided into two subgroups. So we have ordinary living, people living at home. You have typically a centralized care alarm receiving center. And then you have assisted living with people living in groups and, for example, in the nursing homes. Normally, those are not connected to response centers. And of course, there are variations. In UK, you actually have 6 different levels of from ordinary living up until nursing homes. But overall, you can divide it into assisted living, group schemes, and nursing homes and ordinary living. France has a new segment, extra care. I'm not sure if that's the exact translation from French, but basically it's a new solution where nursing home provides care to the surrounding ordinary homes. So it's in between assisted living and ordinary living. And these are examples of the variants that exist in each country. But overall, you can divide it into the ordinary living as well as to assisted living. If you're looking at the market numbers, these numbers comes from Berg Insight, and they estimate that 5.5 million elderly care users connected to ARCs, and United Kingdom being the #1 in terms of volume, Spain being second, and Germany being third. To remember is that still 70% of all the solutions are analog connections. The technical requirements can be divided, if you do it extremely on general level, on the Nordics, UK continental, and the Spanish South model. Nordics are already now going into the second generation digital systems, smart IoT-based systems. UK and continental Europe is going for the first digitalisation, moving from analog to digital. One thing to remember is that in UK, the group schemes are part of the traditional Telecare, so it's a little bit of a mix. And then in Spain and South model, you have what they call a proactive model, where actually phone calls are made out to the elderly prior triggering the alarms. If we're looking at assisted living, nursing homes, long-term care beds, it's estimated, and these numbers comes actually from the European Union, it's estimated to be around 4.1 million nursing home residential care beds in Europe. Mostly it's wired or DECT-based systems that's dominating this, and you have local alarm handling. Right now in the Nordics is that actually mobile technology is replacing DECT, and there is no wired solution left at all. Market will grow very quickly in some countries. As an example, nursing homes in Poland is an area that is estimated to grow very quickly because the generation or people are getting older, and there are very few nursing homes today. One big information is that there is no unified European market requirement, but wireless is becoming the dominating solution in a couple of years. And overall, you're looking more and more into open solutions. And if you take the Nordic level, a lot of things have happened. Smart technology is now part of that, and unifying all ordinary and assisted living into one system. And that's because of how the tenders are done, where the municipalities do tenders both for ordinary living as well as nursing homes. Smartphones has already replaced DECT-based systems in most municipalities, and it's an increased number of sensors around the elderly, and you really start to see the benefits of implementing smart care into the solution. And the requirement now is very clear that you need to have open systems so that you can support new type of use cases. If you're looking from European level, as I said, most of the market is today analog, but important to see is that the shift from analog to digital is happening right now. So already around now, or last year, the number of digital equipment has actually surpassed the number of analog shipments. And this is in the number of units. So it's happening across Europe now that you are replacing from analog to digital equipment. Berg Insight also talks about something they call next generation Telecare, and that's basically the smart devices, the IoT-based solutions. And in 2022, it's estimated to surpass traditional Telecare with type of next generation Telecare in terms of revenue. In terms of shipments, it's a little bit hard to estimate because it's not always hardware included in the shipment. It could be a service that sits on top of something else. But the number of next generation Telecare units are really growing quickly, and it's becoming more and more important part of the care industry and what's provided to the elderly. And this is where the smart care is coming in. You have various different solutions for it, and I will talk more about multiple examples of that in the coming slides. Then there is a third trend, which is happening exactly at the same time. And this is a little bit broader. It's not just for elderly care, but data is becoming more and more essential, and it's requiring open system again. So if you're looking at the healthcare industry overall, you look at organizing complete capture of data. It should be holistic. It should be looking at patients' data all around the elderly. Also, care should be given anywhere, anytime. It should be possible to access your data wherever you are or whenever needed, so that you can have customer-oriented health experience. And of course, to be able to do this, you need to go cloud-based, look at mobile devices, etc., to get access to information. You're adding a lot of advanced analytics, and by adding analytics, you can actually personalize the individual and make individualized care. The analytics provide intelligence and insights into the care that you can adapt to the care situation for that specific person. And the only way for this to happen is that you're moving from digital to smart systems. You need to have systems have seamless integration, exchange of data between systems, and the data need to flow back and forth. Of course, considering GDPR, considering all the rules and regulations that's around us, but the industry has solved that today. And this enables you to move from the digital to the smart system, and actually being able to provide you personalized health around the older persons, not only within healthcare, but also in elderly care. Those three trends are happening at the same time, and this is why we now can see the benefits of implementing smart care. If we're looking at analog to digital, it is not super big difference. You're moving from analog devices that has a large speaker, you have pendants, you have different sensors, and you're moving into devices that has pendants, sensors, etc. The big difference is really when it comes to how the technology is communicating, but it doesn't add a lot of more on top of that. So moving from analog to digital, it gives you, of course, better security. Data traffic is so much more secure versus DTMF, SDMF signals. Unified protocols means that you can make easier porting. It's easier to add new types of technologies into the solution. Adding the element over the air configuration is very, very beneficial once you move users around or you need to upgrade firmware. Suddenly you don't need to sit with old firmware in devices. You can upgrade everything over there. You don't need to go and visit the elderly. And you get a lot of faster signaling during the alarms. But what's important to understand is it also comes with an increased cost. You need to have a dedicated SIM card instead of using the existing analog lines. And also the hardware is typically more expensive because it's newer type of technology. It's different technology inside, a cellular modem, etc. So it comes with an increased cost. And just moving from analog to digital ready does not give any return on investments, because you get improved quality, you get improved performance, etc. But it does not add any element of efficiency within the solution. There are things like when you're porting, it's quicker to do the over-air configuration, but it doesn't change a lot of the operational efficiency that you have around the elderly care. So what does then moving from digital smart? That's when the things are happening. That's when you're opening up the new types of solutions. And this is just examples of different kind of smart solutions. I will present a few of those. But looking at things that I will not talk about here, a smart soul that you can add and have in the shoe with the elderly, being able to track where they are. Smart speaker from Proclaim X, which is voice activated, not connected on the internet, is not sitting on the internet to do all the voice activation. But if you can't push a button, you can use it for voice activation. Or take the smart floor from Elsie, which is another example where you can actually detect falls, etc., from people moving around. So there is a lot of new technologies coming in, and of course the smart watches and smart alarms around that. So by moving from digital to smart care, that's when you're opening up the new solutions, you individualize. If you have someone out walking, why not put the smart zone in? Or if you need medical dispenser, put the smart medical dispenser in, etc. So once you move from digital to smart, that's when you open up the width of different solutions. And you can actually see a lot of improvements in terms of quality, improvements in return on investment, etc. So what does this moving to smart care systems gives you? First of all, personalized care gives increased life quality for the elderly. Having a unified system that one size fits all, that means basically that you have to make a lot of compromises. But if the products and the solutions support a lot of individualized solutions, personalized care, it actually means that each of the elderly actually get increased life quality as well. You get more efficiency within the organization. You can use the tools better as long as you unify the workflows so that you have one workflow to work from. But then adding all the elements, then you can actually start looking at the efficiencies within the organization so that you can spend the time with the elderly instead. You get decreased system cost. If you're looking at it from a holistic perspective, you can actually calculate return on investment on multiple of devices where you see, if I add this sensor, this is the gains I will get. And then looking at it specifically from the situations of what you have. And you actually save a lot of time as well with the unified workflow, being able to work faster because it's one unified workflow where you do everything instead. And smart care systems, which for us means open systems, and I think that's an important part of moving from digital ready to smart care, is that you open up the system, and that means that you can use the best of breed. You don't need to use one supplier hardware for everything. Instead, you can use the best of breed. What is the best sensor for X right now? And that's the one you can implement. Once someone else is becoming better algorithms or better calculations or whatever, then you can switch to that system instead. And it's quite interesting. In Sweden and Norway, we now see that this has already happened. And the reason for that is that Sweden and Norway did analog to digital switch in 2014 to 2018. There are no analog devices left in the Nordics, or Sweden and Norway specifically. And initially, we replaced all the system with digital ready equipment. The problem with that is that the costs actually were increasing. So what's happened now in the second generation, once you start looking at this, that you're trying to get the achievements or achieving the efficiency and the improvements that you want to get from the digital technology. Reducing the amount of administration, sharing data so that you have more better uses of the resources, and all the new type of IT-enabled devices that support you for night watch, fall detection, heart disease, dementia, etc. And there is more and more devices coming out to the market. So every month, I would say there are new devices coming out with new solutions to specific problems. And that's exactly what you can see in overall industry. Once you open up the systems, once they become generic, then you can actually make a market, or you can produce a product for a very niched problem. And that way you can be best on a very niche solution. As long as it fits into the overall system, then you can still get the volume to sell that specific product. And what's interesting is really that Europe and UK have the choice to, when it comes to digitalization, either you take the same route as Sweden and Norway, going for digital ready, going analog digital ready to smart care, and then in 5 to 6 years moving into smart solution. But the other option is, of course, to make a frog leap, going into the same type of systems that's already proven and that are showing the results of what we can do. So looking at some examples then. giving what is the things I was talking about, what are the benefits you can show. And I will present a couple of use cases, real world examples of the improvements and the effects of implementing them. The first example is coming from Senscom. They have Digitalisation, and it's basically a smart sensor that you mount outside a diaper. And this example that we will talk about is specifically for Oslo. And it's a little bit interesting that you can, what you can see. You put the sensor outside the diaper, and being able to look at the saturation level, you can look at micro movement, and being able to detect once it's time to change the diaper. And of course, you want to change the diaper before it's get unpleasant for the elderly. Oslo, you can see that on the map there. And if you want to have more information, you can click on the QR, more info, or you can scan that to get more information. So what are the effects of implementing this? And this is specifically for the case that I looked at in Oslo. And the estimated cost saving after 2.5 years of pilot case is quite big. They actually implemented the cost for the solution is 14K NOK, and they earn 222K per patient. Payback time for this type of solution is 1 to 2 months. So and the reason for that is that you avoid unnecessary inspections, you reduce the need for bed change or sheet change, you avoid treatment, cost of uterus, you get much better, less anxiety for the elderly. And looking at everything, you can actually save huge amount of money. And this is a great example of the return on investment that you can calculate. If you have a smart system in the base, then suddenly you can do all of this and implement and calculate, is this a good solution for me? Well, 1 to 2 months of payback time is quite good. And complexity level is not that hard. Of course, it costs something to implement, but you earn a lot on implementing it. The second example that I would take is Delhi Health. And this is an example from Wisconsin, where they implemented. Just taking some data of health or fall detection and falls in general. Overall, there are 37 million falls that's requiring medical attention every year in the world. And actually, the people above 60 are those that are suffering most from those falls. If you go down and look at Sweden, the cost of falls in Sweden alone is 1.4 billion euros annually. That's the cost that falls are, the cost of falls within the society. And 90% of all Swedes above 8 years had to visit hospitals in 2019 due to falls. So this is a big problem. And how can you implement, and what are the gains that you can do? Delhi Health, they have a solution that is putting AI on top of radar and being able to detect fall with this. And they implemented this in these examples. What they found was that the Delhi solution was actually 91% more efficient than pull cords and pendants. And it means that they contribute to longer stay in the hospital or in the nursing homes, reduction of falls, and less people in hospitals. In this specific case, looking at the sample, and US is slightly different, and this is calculated from the perspective of the nursing home in US, but the annual return on investment from investing in Delhi is actually 600K US dollar, and that's based on a nursing home with 90 people. So implementing this for a nursing home, in this case where you get higher occupancy rate, longer customer lifetime value, and saved operational cost, you actually save a lot on the solution when you get a lot of return on investment from implementing these solutions. Then, of course, there are other elements that's not calculated in here, but the reduced liability risk, and that's, of course, something that is a problem in US. And you get value-based healthcare, which is another upside. And there are multiple examples from this where you actually can get the time to reaction, time from fall to someone is helping you down to minutes by this solution. And it clearly shows the results of quality improvements, and you can calculate again, based on your conditions, calculate the return on investment from implementing this type of solutions. Next case is from Älmhult kommun, and it's Atea and Visir, and they have done personalized smart cares. The goal of implementation of this is to reduce stress for the personnel and freeing up time for the staff and giving a user more safer everyday life. And you can find a link to that. Älmhult is in the south of Sweden. And they implement the Visir solution with overall everything included into one package and the one operational flow. And the solution include dependence, fall sensor, no hand alarms, basically if you can't push a button, voice alarms, night supervision cameras, etc. All alarms are going to the smartphones held by the carer, and logging is done automatically or through the municipality AD system. So you use the same system as you use for other municipality systems. And the results that I show is that, and this statement is coming from Jenny Smedberg, who is the service manager, social service manager in Älmhult. And she says that the care staff gets more time to be where they need to be. You want that last minute, not having to run from there. I see how this will lead to less stress, calmer time with those that are out with the elderly. So implementing unified alarm handling, implementing solutions that is unique for every elderly means that you get much better quality for the personnel. And it reduces the complexity to the same cost as other systems, but you get hugely improvements of quality, and you can actually look at the return on investment as well as you're saving a lot of time. My next example that I will take is from Reidevall kommun, and it's Carium that implemented their night supervision with camera. The goal of implementing this night supervision is to reduce operational cost and also, of course, time. And they had previously integrity issues with people going in and visiting people sleeping. So they want to reduce that with the visits and doing it digital instead. And you can see on map where Uddevalla is on the west coast of Sweden. And what they have done is implemented and replaced the manual visits, someone going into the elderly's home or their room in the nursing home. And the action was previously that we were going in, looking at the elderly for a short period of time, going out, closing the door. Problem is that the elderly is then waking up and they get anxiety, they get worse sleeping patterns, etc. So they replaced this with night cameras. And in this specific implementation, the night camera is facing the ceiling, except for those 40 seconds. So you implement exactly the same scenario as you do physical visits, but you do it digitally. And then operators can watch elderly silently during those visits, but it's only available during the visits. You can't access the video stream at any other time. All activity is logged, so you can see exactly who did the visit, who were looking at everything. And it's not at all possible to get access to the information. And the results of this is actually quite impressive. 25% reduction in night staff based on this implementation. 95, this is actually not specifically for this Uddevalla, but overall in Sweden, you see 95% of all the users that try this and started using night cameras chose to continue. So the elderly likes it, they love it. And of course, now in this environment crisis situation where you are, you don't need to travel around. You do it from one place instead of taking a car and going to someone's house. And Christer Fransson, who is the head of Department of Social Service in Uddevalla, his comments was, remote monitoring makes users feel more secure as they do not have to be woken up in the middle of the night and feel uncomfortable. So again, you can see the reduced, the cost is actually reduced in this solution because it's cheaper to implement, very low complexity, extremely high quality improvements, and very, very easy to calculate the return on investment again. Next example is coming from iSafe. iSafe is making medical sensor, ensuring the right medicine at the right time via medical sackets. And looking at the problem overall, there are 200,000 premature deaths yearly in Europe due to poor medical adherence. The cost in Europe for bad adherence is 125 billion euro per year. Because of the workload for the nurses on care homes, it's actually contributed to 23% of the medication errors in Europe. So it's quite big effort that is, or effect of working the old way with nursing homes and with caregivers. And this example is from Italy, but in Italy, 55% of all hospital admissions for people over 65 depends on medication errors. 55%. So reducing that, of course, you save a lot of time or save a lot of money and improve the quality for the elderly. They don't need to go to hospitals. So the solution that they have is this medical dispenser. It comes in sackets, and you can have up to 2 weeks of medications in there. The caregivers are getting alerts, or carers, the elderly getting alerts when to take the medication. It's showing in colors when to take it. And all the caregivers gets alarms if it's not taken. And that, of course, save a lot of things. So the result is that you save lives, you get a better supervision, you get reduced faulty medications because you know what they're taking. You save a lot of time because you can monitor this on distance instead of going there and helping them out. You know when they're taking the alarm, or sorry, taking the medication. And fewer hospitalizations, of course, mean reduce healthcare cost overall for society. And you get a better usage of the staff personnel that can spend the time with the elderly instead. So again, showing huge improvements on quality and big return on investments actually implementing this. Of course, comes to a cost, but it's very easy to look at the benefits of the solution. My last example is from Moss Kommun. It's outside Oslo, and it's with Carium and Tieto Every. And they have made an integration and data exchange of the solution. The goal of the integration was to reduce number of manual calls and manual documentation. And they also want to have improved quality for the elderly. And you can find more about this article down to the left there in the QR code. The solution, this is a little bit small, but the alarm solution is then triggered via normal devices, goes to Skyresponse, and we distribute it out to the response center. We can fetch the ID for the elderly, so you can access the medical, or sorry, for the caregivers, you can access the medical records seeing that who's in there. So you can display the stored exchange data of that's available in the system. A unique feature of this is that you get the list of available resources. So the ARC personnel can actually see when is the next planned visit. So if the call is coming in at 11:45, they can see at 12 o'clock, the caregiver will arrive to the home. And they can tell the elderly, they are coming in 50 minutes. That's the planned visit. And it's actually Martin that is coming. That increased the quality and, of course, reduce anxiety for the elderly. With the integration, you can actually automatically upload the actions taken as well. So you can add that into the Tieto life care system. And then you end the data, and you have data that is shared along the different systems. So the result of implementing this is that you get a reduced number of calls to the response centers. And you don't need to make manual calls to all the caregivers because information is transferred as data instead. You get significantly reduced manual documentation because data is transferred instead through the systems, and you get improved service by actually being able to tell the elderly when is the next visit happening. And Roger Renberg, who is the project manager in Moss municipality for this, he said Lifecare Mobile Player, and that's the product name, is the best solution I've seen on the market. We at Moss are proud to be the first out with Doro Care, and that was at the time when Doro still had the name of, or Carium had the name of Doro. So Moss are proud to be the first out with Doro Care security alarm with closed loop, which creates traceability throughout the event and security for all employees and residents in the municipality. So again, a good result of what's happening. So if we try to summarize this, the benefit of making a frog leap directly to smart care is that you can spend more time with elderly. You get more efficient usage of the time that you have within the personnel. You get significantly better working environment for staff and care personnel, less stressful, focus on the care receiver instead. You have more freedom and higher quality for the elderly because you can implement personalized care. You don't have one solution fits all. Instead, you're actually able to individualize everything. And of course, that creates significantly more freedom and high quality for the elderly. Data collection, nothing gets lost in manual handovers or voice calls, and data is transferred as data instead, so it's actually not destroyed. And it also means that it's foundation for decision-making managers, because you have access to the data. You can calculate and see what's happening. If I implement this, what is the effects, or do I need to change something in my operation manual? And financially, you get higher return on investments. You get a less staff cost overall, as the example with Doro and Reidevall, a 25% reduction in staff cost. So you can really see the benefits of going to smart care. So how do you get started then with smart care? And I think this is in the important things. If you want to go with smart care, you need to have platforms that are open. It shouldn't be locked into specific hardware. It should be open to add new hardware. And it should be open and well documented and free APIs. Free APIs means that it is open. If you have a lock-in through charging through APIs, then it means that there is actually a lock-in to the system as well. It should be prepared for data sharing, data lakes and integrations, etc. It needs to be cloud-based because you need to have implemented the scalability, the SLA driven, you need to have the APIs that comes with normally with a cloud-based solution. And you should also have the privacy by design from the start. It should be flexible enough to support personal care through a lot of configuration, and it should be very easy to test new use cases. Again, talking about the free APIs, imagine you as a caregiver, if you cooperate with a university, the students can access the APIs and implement and build solutions on top of the alarm handling system or the platform that you're using, dependent on where you are in the value chain. But so it's important to have the possibility to test new use cases and test new products. So with that, Anna, are we going to the polls, or are we going to?
No, I think we should move to the questions. Yeah, so we have one question. How do we compare to the UMO solution?
The Skyresponse?
Yes.
From our perspective, I think the biggest difference is that our platform can handle all use cases. It's not just a response center solution. So you can handle all the use cases from very first B2B solutions up until nursing homes. That's one big difference. And I also would say that the open APIs and the scalability of implementing different technology is the other big differentiating factor. For us, it doesn't, an open API, as an example, it means that we don't need to do the work. If you have your own supplier of IT work, then you can actually hand over the integration to them. If you have your own department doing the integration, they can work on open APIs and do the implementation between the systems. And I think that's the biggest differentiating factor between those two systems.
Thank you. Then we have what are the key SLAs?
So key SLA, if you talk about availability SLA, so what the system should be available. And I think a properly implemented cloud-based system should have SLAs up until, typically in telecom, you talk about 5 nines, so 99.9995. Normally you don't get that type of solutions because the overall technology is not ready for it, but the core system should be able to support that. It should be up and running. So in terms of what to measure, a key SLA factor is obviously the availability of the system. And you need to look at the different parts of the system. But the core alarm handling, if we're talking about that, I think it should be close to 100%, basically. It needs to be available every time, and you can't go down, because then you can get fatal effects if someone is dying or a house is burning down.
Yeah, thank you. That was all the questions for now. So if there's any other questions, just write it in the chat or in the Q&A box.
Excellent. So I hope you enjoyed this. I think, Anna, we will send out the recording later on, and then you can also look at the read more about the different use cases through the QR codes, etc. And please reach out to us if you have any questions. You can find us online, skyresponse.com, and you can find me there on either LinkedIn or on our webpage.